It's time to talk about HIV and children. Once again, children are being left behind in the global fight to end AIDS. Inequities between children and adults are growing instead of shrinking, from testing to treatment to research to funding. Despite all of our progress, approximately 430 children are still newly infected each day because their families don't have access to prevention services. Nearly half of children living with HIV are still not receiving life-saving antiretroviral medicines, and time is not on their side. That's why now is the time to prioritize pediatric testing, care, and treatment, and to fund evidence-based pediatric HIV research. Now is the time to support local leadership and community-led efforts, and to raise our voices. The Elizabeth Glaser Pediatric AIDS Foundation helped start the fight to ensure that every child can live a full and healthy life into adulthood. As Elizabeth Glaser said, what's the point of caring if we don't do something about it? Now is the time to finish the fight for an AIDS-free generation.
Elizabeth Glaser Pediatric Foundation, EGPAF. It's an international organization, and it was started by one Elizabeth. So for Elizabeth, she's one of the unfortunate women actually who got to lose a child to HIV. Having been transfused with blood that was had the virus, she got to get infected. She didn't know initially. Then she also got to lose a child, and through it, she initiated the foundation, and the foundation has been there for the longest in the country. It's been there for over 20 years. So what we do is just to make sure that we work with the health facilities. Basically, our mandate is to strengthen the health systems, just to make sure that we get to make sure that we're getting all the steps, or rather the entire cascade of HIV programming, starting from making sure we are able to prevent HIV infections, majorly by testing, making sure that we get the pre-exposure, or rather the prevention combination methods. We make sure that we take care of the HIV positive. And this one cuts across both the men, the women, the children. We make sure that you're also looking at them. We're also looking at the children. Our main mandate is actually pediatric HIV. And if you look at pediatric HIV, we're saying that it's been left out and we need to talk more about it. Currently, we're doing HIV programming under the LVCT project. We have one project in Homa Bay. I know we've been able to interact with the Homa Bay project, whereby we're looking at also the entire cascade of HIV programming, and also in the central project. Though we have other programs fine beyond that, but for HIV, we are currently working in Homa Bay, and also offering technical support for the Kisii project. And in central, we are working majorly in Kiambu and Murang'a, and offering support also to Nyeri and Kirinyaga, just to make sure that we get to support all the HIV positive clients that we have in this region. Yes, in terms of prevention of mother to child transmission, we are working majorly also in the same regions, just to make sure that we get to the less than 5%. And I'm happy to report we've seen great progress, having transmissions at 5.5 in Homa Bay, which is also a very high burden county, at 5.3 in Kiambu, which is also a high burden county. Then we have also others that are almost getting to elimination, at 5.8 in Kirinyaga. We have about 7 in Murang'a, and these are some of these counties that you're working with, 7 in Nyeri, sorry, and 8.3 in Murang'a. And these are counties that you're working with to make sure that you get to elimination. So using, or rather being supported by our donors, and especially in this case, through PEPFAR funding, then we are able to support the different counties, just to make sure that we have our health systems working. We have commodities in these facilities. We have our programs for the different groups of people that you have in these facilities, just to make sure. We said one of the key things is adherence. Then are we able to offer psychosocial support? Are we able to educate capacity building of our clinicians in these health facilities to offer quality services to our patients? We also have engagements of the peers. When you talk about the peers, we're looking at people living positively, both men, women, adolescents, just to come in on board and support treatment. We know the best teacher is experience. So once we have somebody who is already living positively in the program, then they're able to support their other peers to be able to walk through this journey, because we may be there as doctors, but you may not be able to tell, or rather you may not be able to walk in the shoes of this person who's HIV positive. But once we have somebody who's already living positively, it's easier to be able to talk to them. As we give them treatment, then we have other people who are able to walk the journey with them. So we support the entire cascade, just making sure that we get to elimination, both of mother-to-child transmission and also ending AIDS by 2030. So that's our main mandate, and that's what we are working towards. And also not leaving out other NCDs, the non-communicable diseases. We've worked through, especially now we're looking at mental health, which is coming in as one of the key areas that we really need to address, and also something to do with tuberculosis, TB. We know that TB is one of the killer diseases that's really finishing most people, and especially if it goes untreated, it's going to kill faster than actually the HIV that's not treated. So that's one of the areas that we're also looking at in terms of being able to integrate services across board, including TB programming and other diseases. So there's quite a lot that we're really trying to cover and making sure that we get miles in terms of offering quality care to our patients, and optimally making sure that they get to suppression and they live a quality lives. Then you're talking about the pediatrics, or rather the children, and we need a voice for the children. The reason we need a voice for the children is that they are a vulnerable population, and at times we may not be able to talk about their issues, we may not be able to talk about themselves. So for the children, then we need a voice for them, and the voice from them can come either from us who are adults who are able to interact with the pediatrics, or the other voice that you can have for these children is also through media. Can you have somebody talking on behalf of these children, just to make sure that as you look at the prevention of mother-to-child transmission, then can somebody make sure that our children are not getting infected because the mothers have declined, or they've refused to take their ART. On the other hand, is for those children who are already living positively, then can we look at the various people who take care of these children? One, we have the caregivers. At times we have caregivers who are not the actual parents. At times we have the parents themselves. But what we need is someone to take care of these children, somebody to speak on their behalf. To make sure that they get their treatment, and they get their treatment on time. Because if we look at the infections for these children, if they don't get treatment, it looks like half of them by the time they're getting to their first birthday. By the time they get to their second birthday, you lose like 2/3 of them. And by the fifth birthday, we lose so many children. So we need somebody to make sure that they also talk on behalf of the children. If they're HIV infected also, can they get treatment and get it on time? So what we need to do is just making sure that when you're talking about demand, everybody comes in to make sure that we have a voice, not just a voice from the hospitals, not just a voice also from the media. We also need our government to come in. Can we have policies that fully support children? Can we have, we saw like in the last Maisha Youth Conference that was held last year by the National Syndemic and Disease Control Program, which is the national program coordinating HIV matters. Then we saw the call for us to have the pediatric caucus even in parliament, such that can we have somebody even pushing for the rights of these children at a different level. And that's one thing that we need to make sure that we make a difference in. Let's also talk about children. They're also getting infected. Let's have them also getting quality health, such that we're able to talk on their behalf, so that it's not just about women, it's not just about the men, but also we need to talk about the children, because they've been left out for the longest, and we just need to make sure that we also include them in the conversation. One of the key things about this workshop is that it really involved the communities, because we have to go back to the drawing board. The community has to be involved when it comes to their engagement, like the discussions we've already had. We need to have that say in the community. So one of the take homes was we need to end the HIV-related stigma. And the way to do this is educate the communities and educate the masses on it. And one of the sessions also we had is about advocacy and also media. How do we talk to these people in the community, which was very pertinent in terms of advocacy at the community level. So the take home, one of it is let's engage the communities more. Let's hear more from the communities. That way we are able to address the issues of those people living positively with HIV. We're able to address their concerns and making sure that they get the quality life that you're looking for. The other take home is, with so many strategies that we were able to discuss across board, starting from the prevention, starting from looking at those non-communicable diseases, looking at other comorbidities that affect our women, looking at the male engagement. So what strategies are we able to take home? As a country, what is it that we've not adopted, that we need to adopt and start practicing in our health facilities at the community level? What is it that we need to take home? So it's up to us to look at the new things that we learned from that conference and make sure that we take that home and be able to implement. Some of the things are already working, but there are new strategies that also came up with what was not working. So our main role is to take that up and be able to run with it. It's not a one-size-shoe that fits all. You look at different counties. We may be doing well in Kiambu in terms of one area of implementation, but you find that maybe a county like Turkana or a county like Mombasa is struggling in another area. So what area are you really struggling in, and what is it that you need to take home for your county to be able to implement? So basically, it was a call on each and every one of us to look at what is not working in our different counties, what is not working actually at the sub-county level, and even at the facility level. Whatever is new, whatever is not working, let's run with that so that we make sure that as a country we're able to get to the same level in terms of eliminating AIDS by 2030. Yes, and we're going to have also another conference next year, end of next year actually, and we'll also be looking at similar matters. What were the take-homes from this workshop? What is it that we learned? What is it that we've been able to implement? And even as we implement, this is where our researchers come in. What is it? What is the new knowledge that we're getting? And what is it that we're able to write about? What are our best practices? What is it that has worked? We should be able to document the same and then share the same in the next workshop, and make sure that the whole world gets to learn about what we are doing, hoping that as we continue engaging the new strategies and the new things that we are learning, then we should be able to eliminate AIDS by 2030. Women are infected, women are getting affected, and we need everyone to get involved in it. Let's support the women. Let's end the HIV-related stigma at the community level. Let's embrace the women at the community. Let's support them. And in this, we know that we're going to make a difference. Yes, it's all about women. Let's engage them. Let's support them fully. And when you talk about women, let's not forget we have young and we have the old women. It starts with the young women and also all the way to the older women. So let's engage all women in this talk. Yes. And most importantly, our adolescent girl and young women. Let's make sure that we engage them fully to make sure that we reduce on these new infections amongst our adolescent girls and young women. When we get a chance next, we're going to talk about a triple threat amongst the adolescent girls and young women, which actually is really the next thing that we need to be talking about, and how to eliminate that for the adolescent girls and young women. And also as they age, let's look at the quality of care that we're offering to these women.